Hi, can everybody hear me?
Yeah, you make me a good character. Like the animals.
Hi, everyone. Can everybody hear me?
Crow, eagle, flamingo, swan, owl, canary, pigeon, robin, gull, hummingbird, toucan, humming.
Can you guys hear me? Okay, so we're good to get started. So what we're gonna do, there might be a few other people join in a little bit later on. We're expecting a few more. So what we're gonna do is we're gonna go through some of the presentation. If you guys have questions in the middle of it and you wanna stop and clarify something, just type it in this chat here and I'll address it right away. And then at the end of the webinar, I can unmute everybody and we can have an open discussion about anything you guys are confused about or any other questions that you have. Okay, does that sound good? Okay, perfect. So let me just get, sorry, this is our first webinar, so I'm just getting accustomed to all of the technical stuff here. So, okay. So you guys everybody can see the screen okay? No issues there before we get going? Okay. Perfect. Okay. So, oops. All right, here we go. Okay, so I'm Jenna. I'm one of the rehab practitioners and RBTs at SOAR Veterinary Services. During this webinar, we're going to discuss what a cranial cruciate ligament is, how a rupture occurs, how it affects our pets' long-term joint health, and how to manage the cranial cruciate ligament injury for the first 2 weeks after an injury. Okay. So the cranial cruciate ligament is very, very similar to the ACL in the human knee. So the cranial cruciate ligament is one of the main stabilizing and load-bearing ligaments in the canine knee joint. And we also call the canine knee joint the stifle joint. So we may use those terms interchangeably during this webinar. It can also be referred to as the anterior cruciate ligament, which means towards the head as well as cranial, okay? But we more commonly call it the cranial cruciate ligament. So when we're looking at this diagram here, this is what the canine knee looks like from looking at it head on. Okay, so our first bone up here is the femur, and then down below is the tibia. Okay, and right where this little red arrow is, that is your cranial cruciate ligament right there, if you guys can see my mouse. Okay, so the cranial cruciate ligament stabilizes the knee joint by joining the femur and the tibia together. And so the cranial cruciate ligaments get their name based on their attachment to the tibia. And so we have two cranial cruciate ligaments in the canine knee, which are two cruciate ligaments, which are the cranial cruciate ligament and the caudal cruciate ligament. The cranial cruciate ligament originates at the back of the femur and inserts on the front of the tibia, okay? And it's right between the two meniscus, okay? So that's that one right there. And then you have your caudal cruciate ligament, which also contributes to knee stabilization, but it attaches to the front of the femur to the back of the tibia, okay? So we talked about the meniscus, and that's where the cranial cruciate ligament comes forward between. And so that's these little disc-like figures right here, okay, on either side. And so there are two meniscus. One is the lateral and one is the medial. And both of these are cartilaginous tissue that partially divide the surfaces of the knee, and they're on the articular or the joint surface of the tibia. Okay, so we've got your medial over here and your lateral over here. And so what they do is they are little kind of like little hydraulic cushions, and so they help to distribute the weight-bearing forces of the knee joint, okay? And so the medial meniscus is one that we'll be talking about a little bit more because this one has a much firmer attachment to the tibia than the lateral does. And so when there is any type of instability or movement in the knee, this meniscus is much more prone to injury because it doesn't move as freely as the lateral one does. Okay, so we're going to talk about that a little bit. So we have a video here, but I'm going to just explain it quickly and then we'll watch the video. And then if you have any questions, feel free to just write them in the chat there. The cranial cruciate ligament's job is to prevent forward displacement of the tibia when weight bearing occurs. The craniocruciate ligament also acts to limit hyperextension of the stifle joint as well as internal rotation of the tibia. When the craniocruciate ligament is torn, this creates instability in the knee, and the tibia becomes more mobile in relation to the femur. The tibia will repeatedly slide forward when weight is placed on the joint. So every time a dog takes a step, the tibia will kind of displace in a forward motion. And this causes constant rubbing of the joint surfaces of the femur and the tibia together, which can cause damage to the joint cartilage as well as the meniscus, specifically the medial meniscus. Damage to the meniscus can often be identified by an audible click or popping noise when the knee joint is flexed. And this can be a very painful thing for our patients and usually indicates a very significant amount of damage to the craniocruciate ligament. And there's a pretty significant amount of joint stability there as well. So we'll watch this video, and I hope that it plays well. If not, you will get a recorded version, and the videos play much better on that. So you can see those two little disc figures here. So those are your menisci. And so when the craniocruciate ligament is torn, the tibia will actually be able to be thrust forward like that. So you can see how painful that must be. So a craniocruciate ligament tear is the most common orthopedic injury in dogs. So we quite commonly see this type of injury. Craniocruciate ligament tears or cruciate disease. So sometimes you'll hear people refer to it as cruciate disease because it is a degenerative condition that usually causes pain, inflammation, and even osteoarthritis to occur within the joint. Okay, so when dealing with a craniocruciate ligament injury, we also need to understand what osteoarthritis means because there is a link there. So osteoarthritis is an inflammatory process associated with destruction and loss of cartilage that promotes remodeling of the bone. Okay, and that's what we refer to as osteoarthritis. Craniocruciate ligament rupture and consequential stifle instability is the leading cause of osteoarthritis and inflammation in the canine knee joint. Joint destruction as well as cartilage damage is a result of osteoarthritis can be irreversible. So the key to successful management of osteoarthritis is really intervention and prevention. And that's because inflammation and osteoarthritis often begin to develop in the early phase of ligament degeneration. So at that very first sign of the ligament degenerating, there is likely cartilage breakdown, inflammation, and osteoarthritis already there, even maybe before the dog starts limping or showing any type of clinical signs. So it's really important to keep a close eye on their clinical signs and also to make sure that we're intervening early at the first sign of anything. So why does the craniocruciate ligament actually rupture and how does that happen? So there are many risk factors associated with why the degeneration of the ligament occurs, and we're going to take a look at a few of those now. The main risk factor is because the actual articular surface or the joint surface, which is right here on the tibia, is actually sloped. And so that's called the tibial plateau. So these dogs have a sloped tibial plateau. And when a dog is standing, their knee isn't completely straight like ours is. So they kind of keep it in a semi-flexed position. And because they're in that position, it forces the tibia forward more than our knees do. And so that means that there's constant stress on the craniocruciate ligament. And so over time, the wear and tear on that joint will cause the ligament to degenerate. We also know that large and giant breed dogs are more predisposed to cruciate ligament disease. And so specifically Labradors and Newfoundlands have a higher link to having cruciate tears, but overall just larger dogs are more predisposed. And then we also have high intensity of activity. So any uncontrolled activity that involves sharp turns, jumping, pivoting, causes more twisting and twerking of the knee joint. And so that puts some abnormal stress on that ligament and can often cause it to degenerate. And overweight dogs. So any dog that is overweight, whether it's mildly overweight or obese, these dogs are more prone to getting cruciate tears. And that's because of the increased weight-bearing forces from the extra weight on them. But as well, there is an inflammatory link to extra fat cells in the body. So it can be a metabolic problem as well. And then we also know that our neutered and spayed pets, because of hormones, are being shown to be more predisposed to cruciate ligament injuries. And then one of the big ones is just having poor joint or limb conformation or biomechanics of the leg. So the conformation and slope of the tibia can vary from dog to dog. And even if a dog has a slightly steeper tibial plateau, this can put a lot of extra stress on that cruciate ligament, therefore accelerating the degeneration that's going to go on in that knee. Any pre-existing orthopedic conditions can also contribute to the risk. So whether it's genetic, whether they're born with some type of limb deformity, or whether it's injury related. So even like hip dysplasia or luxating patellas, anything like that will put different forces on the knee joint and will contribute to increased acceleration of the degeneration of the cruciate ligament. And then just general strength and so poor strength of the other ligaments and muscles surrounding the knee. So a lot of the other hind limb muscles or ligaments will contribute to supporting the knee. And if those are weak, so in a dog that has lots of muscle loss in the hind end, whether it's neurological or whether it's just the way that they are built, they will be predisposed to a cruciate ligament tear as well. And then having a previous cruciate injury on the other hind limb will predispose the dog to having it on the second hind limb. So due to the degenerative nature of the cruciate ligament disease, a patient with a ruptured cranial cruciate ligament possesses a 50 to 60% chance of rupturing the opposite cruciate ligament. So that's a pretty high number. So we need to definitely be aware of this and try to maintain the other leg as well, even when we're treating the leg that has the current tear. And this can be also just because of the compensation stress. By when they're offloading off of their injured leg, they will put more weight onto the other leg, therefore increasing the weight-bearing load and accelerating the degeneration of the cruciate ligament. So how do we actually identify a cruciate ligament tear? So I'm just going to kind of take you through what we typically look for when a dog comes in limping and we're suspecting a cranial cruciate ligament tear. It's kind of what we look for at SOAR during their first appointment with us. So we often ask about a history of lameness. So a lot of owners will say that they don't notice anything until there was this event, the dog chased a squirrel, or it ran after a bunny, and or it was chasing a ball and it all of a sudden came up lame on the leg. Or owners will say that yes, there has been a progressive intermittent lameness for the span of weeks to months to sometimes even a year, and then it just got progressively worse, and now they're looking for treatment. We also look at their weight bearing. So is the dog non-weight bearing? So sometimes they'll come in actually holding their leg up. Some dogs will be toe touching on that leg. And then some dogs will come in with a very, very, very mild weight bearing lameness. And so there is quite a variety there. And so we need to pay close attention. So this video here, this just shows typically what the dogs come in walking like. This is pretty typical of what a cranial cruciate ligament tear would look like. The dog is kind of keeping, I'm going to play that again. The dog is kind of keeping his leg in a semi-flex position. You can see that there's quite a bit of muscle loss there with that divot right behind the femur. And so they just kind of have this really stiff walk. We also talk to the owners, and a lot of the times they'll report that the dogs are having difficulty with daily tasks. So whether they're unable to climb the stairs now, whether they're having problems posturing to go to the bathroom, having difficulty with transitioning, so get difficulty sitting to standing, they're stiff to rise from a laying down position, and as well, sometimes they have these abnormal postures that they didn't used to have. So these dogs, when they go to sit, they'll have kind of that lazy sit position where that one leg will stick out to the side in an extended position rather than kind of keeping it nice and tucked in beside where it should be. So this dog here, So he's quite stiff to get up, and then he does this little tap dance thing to try to get into the sit position. So he's got pretty sore knees that he doesn't want to flex them and sit down. So that's pretty typical. And then of course we do our physical exam. So the very first thing we usually look for when we're suspecting a cranial cruciate ligament tear is a medial buttress. And so that's kind of our telltale sign of a cruciate tear. So this is the body's way of throwing up scar tissue on the inside of the knee joint to try to stabilize the knee. So it's all about, for the body, it's all about trying to gain stability in that knee so that it's not rubbing, so the two bones aren't rubbing on each other. And so sometimes also we'll see swelling or heat or even redness around the knee joint. We'll also palpate for areas of pain around the knee, specifically on the inside, kind of near that medial buttress area. Sometimes we'll have areas of muscle tension that would lead us to believe that there has been some compensatory postural changes. So sometimes they'll be really tight up in their shoulders or in their groin because they've been shifting their weight to try to accommodate for that sore knee. Sometimes we'll see muscle atrophy. Depending on how long it's been going on for, these dogs could have lots of muscle atrophy, and there'll be a big difference between the two sides. One will be really muscled and one will not be so muscled, and that's just from not using the limb as much as they should be. And then our two diagnostic tests that we use are cranial drawer test and the tibial thrust test. So I'm going to show you some videos to show you what that looks like. And so these are, we'll kind of, anytime we're suspecting a cruciate tear, we will do this manipulation on the dog to test the integrity of the cruciate ligament. So I'll play it first here. Okay, so with this test, we kind of use strategic placement of our hands and try to move the tibia forward in relation to the femur. And if the cranial cruciate ligament is ruptured, the tibia will actually displace forward. In a normal staple joint, there will be no movement there. And so in this video, I'll play it again, and you can see that there is quite a bit of wiggle there. And now we have tibial thrust. So with this manipulation, the hock is flexed in attempt to try to displace the tibia forward. And if the cranial cruciate ligament is ruptured, the forward movement of the tibia can be identified with the movement of the forefinger that's placed on the tip of the tibia, kind of right here. Okay. So in a minute, you'll see that tibia ride forward. There we go, and then it pops back into place. Okay, so that's a pretty significant tear right there. Okay. In very severe cases, both cruciate ligaments can be affected. It can happen within a short period of time from one another or even years apart, but as we did say earlier, it is quite common for both cranial cruciate ligaments to tear. And these patients are typically very, very painful and have significant difficulty sitting or rising. So that video that I previously showed of the dog sitting to standing, that dog actually had both of its cruciates torn. Often they'll kind of shift weight from one hind to another and do this little tap dancing thing because sometimes they can't choose which leg hurts less to stand on. So sometimes the lame leg can change from day to day. One day it may be the right that hurts more, and one day it might be the left that hurts more. And so we just need to pay attention to that. And a lot of times these dogs show severe intolerance to exercise. And now it is possible for the cruciate ligament to be partially torn as well. And so with a partial cruciate tear, some of the ligament is actually intact. So some of those fibers are not degenerated. And so the integrity of the ligament is compromised, but there is still femur and tibial attachment. So these dogs may have some degree of instability because there's not the full cruciate ligament there, but some also may not. So if the dog is really well muscled, then they can counteract with the force of their muscle to prevent that instability and that tibial movement forward. And partial cruciate ligament tears will often continue to degenerate and will sometimes end in a full tear if there's no intervention. And so usually we need to get these guys into rehab really quickly so that we can start to manage them appropriately and prevent future degeneration if we can. Now in x-rays, we cannot visualize the cranial cruciate ligament itself, but we can see the characteristics that may be indicative of a cranial cruciate ligament injury, as well as secondary arthritic changes. So this here on your left is a normal knee joint in an x-ray, and this is an abnormal knee x-ray. So on your right here, you have a dog that has a cranial cruciate ligament tear and some osteoarthritic changes. And so here, right behind the patella tendon, which is right here, if you can see my mouse, right in this area here, it's nice and dark, okay? And so that's the joint space. If we look at this one, it's kind of cloudy. So that is showing us that there's some swelling and inflammation in the joint area. We can also see here that this patella tendon that comes off of the patella onto the front of the tibia is a little bit inflamed and thickened compared to this side. As well, if you look at the placement of the bones on each other, the femur in relation to the tibia here, the tibia on this x-ray is a little bit displaced forward in regards to this one, okay? So if you look at it and align it that way, it is a little bit forward. And so that's where we get that tibial thrust movement from. And then the last thing here is the arthritic changes. So when we look for arthritis, we look on the surfaces of the bone. So the articular cartilage area. And so right here, you can see that there's a little bit of roughness, right here, kind of moving back to here, and where it's nice and smooth here. So that's kind of how we look at those x-rays and determine whether this dog has signs of cranial cruciate ligament tear. So how do we actually go about treating these injuries? So we're going to talk about kind of the treatment of cranial cruciate ligament tears, and there's a few options here, but the main goal is to alleviate the source of pain, which is in fact the instability. That's what these dogs are trying to avoid, is the thrusting forward motion when they walk, because it is quite painful. And so we try to mimic the normal biomechanics of the knee as much as possible to decrease pain and slow down that progression of arthritis. And so we can do this with surgical repair, but we can also do it with conservative management. So just one thing to note, that a patient's age, conformation, size, activity level, lifestyle, and concurrent medical conditions are always considered before we decide on a treatment plan for any dog, because we need to make sure that each treatment is safe for the dog to undergo. So our first surgical repair is the TPLO. And this is also called the tibial plateau leveling osteotomy. So this involves actually cutting the top of the tibia and rotating it to level out the tibial plateau. So that tibial plateau that we talked about earlier, that's quite sloped. Now this is just rotating it so that it's a little bit more level, and so there's not that slipping off of the tibia in regards to the femur. And so the cut in the bone is actually secured with plates and screws. And it is the most common type of surgical repair that we typically see in veterinary medicine. And it is most best suited for any dogs weighing over 10 kilograms. Okay, so it's mostly for medium to larger dogs. It can be done in smaller dogs as well, but it is best for, it works for all dogs, but for larger dogs, it really is the best option. Next, we have the TTA, which is also called the tibial tuberosity advancement. So this involves, again, cutting the front portion of the tibia and displacing it forward. So we're actually going to be increasing that tibial surface so that the femur is not riding off it as much. And that helps to stabilize the knee. And the bone is, when the bone's cut, it's secured with a spacer, plates, and some screws. This increases the stress on the patella tendon. So you can see here that it is quite stretched outward. So these dogs can get a little bit of tendonitis. So it is a little bit less successful than the TPLO and therefore less commonly done. And then our next one is the extracapsular procedure, or sometimes called the lateral suture. And this involves a synthetic suture that is threaded around the joint, mimicking the cranial cruciate ligament. So this helps to stabilize the knee, but it's not a forever fix. Really what it's doing is it's holding the bones in place while the body throws up scar tissue to try to stabilize that knee joint. It is a very fragile surgery because it's just using a small suture and a few metal crimps. So it is more commonly used in the less active dogs and the dogs that weigh under 10 kilograms. So because it really isn't sturdy enough to withstand the forces of any bigger dogs or high energy dogs where there's going to be lots of movement of that knee during movement. And it does require a lot more exercise restriction and therefore a much longer recovery. So with any surgery, there are risks. So we worry about post-operative infections, whether it's the implants or the plates or the screws, or just the incision, just from having the skin cut open and it's sutured up. And this can happen, we can always get the infections immediately or in the future. So somewhere down the line, these dogs can have infections as well. The implants can also fail or break down, so breaking of the plates or the screws is possible. There can be failure of the procedure due to non-compliance with exercise restrictions. So we really need to make sure that these dogs are exercise restricted. Otherwise, the procedures won't work themselves, which is why we need to take into consideration the dog's lifestyle when we're choosing. And then, of course, anesthetic risks. So some dogs are not good candidates for anesthetic. So we need to think about that. And as well, it can be a costly procedure. So for having a lot of risks, a lot of owners may not be able to financially commit to a surgery. So surgery may not be ideal for all patients, and that's okay because we do have options. Cranial cruciate ligament injuries can be managed with rehab. And so we call this conservative management. And conservative management can provide great recovery outcomes to patients where surgery really isn't the best option. So we're going to just talk about a little bit about what conservative management means. So conservative management relies on the scar tissue formation around the stifle joint, as well as muscle strengthening to encourage stability of the joint. So ultimately, we're just trying to promote that stability in the knee joint and prevent the riding forward of the tibia. So we can do that by strengthening muscles as well as promoting proper laydown of scar tissue. Cranial cruciate ligament surgery is never an emergency, so we always give people options before we rush to surgery. So conservative management can always be attempted first. There is a possibility to avoid surgery if the patient really improves and we get them strong enough that the knee is stable and they may not need surgery at all. They may still need surgery, but it is a possibility. And so if we can avoid that, we'd like to do that. Small dogs really do quite well with surgery, with conservative management because they're so small. And so there's not a lot of weight-bearing forces on those legs. And they also need a lot less scar tissue to stabilize the leg than larger dogs do. So they do quite well with conservative management and don't always need surgery for their legs. If a patient does not improve with conservative management, then we can always opt for surgery at a later date. And even after the surgery, because the patient has already undergone rehab, we've likely strengthened that leg. We've likely improved the spatial awareness of that leg. And so these dogs usually have a better outcome after surgery anyways. So we really have nothing to lose with conservative management. So with conservative management, we aim to treat acute and chronic pain and inflammation, as well as promoting joint health and slowing progression of arthritis. And so we do that using a multimodal approach. And that means just kind of throwing a bunch of different things at these dogs to try to get the best possible result. And so we do that with pain medications, we use joint supplementation, we do rehab treatments, as well as manual therapies. We can improve strength and proprioception with therapeutic exercise programs. So when we talk about proprioception, we mean the spatial awareness of the leg. And we can also discuss options for a brace to help with the stability of the knee joint. And we'll talk about that in a little bit. And we can also promote optimal mobility by treating the whole body. So we call this the whole body approach. And so this means that, when we're dealing with a cranial cruciate ligament injury, it's usually not all we're dealing with. And there's usually associated back pain and muscle tension or pain in other limbs that come with the cranial cruciate ligament tear. And just the compensation that the dog is doing to try to accommodate for it, as well as there may be existing osteoarthritis in other joints. And so we opt to treat that as well. If the dog has elbow arthritis as well, we're gonna treat that and try to improve that as well as the cranial cruciate ligament tear. Now with conservative management, recovery may be a much longer timeline than that of surgery. And so it may not save you a lot of time because it could be anywhere from 6 to 18 months to really get these dogs back to doing what they're used to doing and back to their kind of regular activities. It can also be quite costly. So a lot of people think that we may save a little bit of money avoiding surgery, but that's not always the case because often these dogs need pain management long-term, as well as their rehab sessions will come with a cost. But all in all, mobility and their quality of life can be maintained. So we must be aware that there are options, and we need to closely consider all those options before we decide on the best treatment for our pet. Okay. We understand that it can be stressful when your beloved pet suffers a cranial cruciate ligament injury, especially during COVID-19 when vet appointments, surgical consultations, and surgeries are all being canceled or postponed. But luckily, there are a lot of rehab treatments that can be implemented at home to start managing your pet's cruciate injury and kickstart their recovery right away. So we're going to discuss some home rehab programs for the first 2 weeks after a cranial cruciate ligament injury, up to 2 weeks post-injury, okay? Or post-surgery. So this is the first phase of recovery and is often the most crucial in gaining optimal mobility for the future. Typically, the recovery for the first 2 weeks for a cruciate repair, so having surgery for the cruciate tear, is often the same as managing it conservatively. So we're going to kind of lump those two together in the next bit when we're talking about treatment options. And during phase 2, the conservative management and post-operative recovery approaches differ a little bit, so we'll need to pay individual attention to that, but that will be in the next webinar. So first is rest. So we really want to make sure that these dogs are adequately rested. And so we usually recommend crate rest when they're unsupervised. This really is the safest way to go because we want to control any extensive roaming in the house and limit risk of jumping, because that's really what's going to set these dogs back with their recovery. If they're not crate trained, we recommend usually putting them kind of confining them to a room where there's no risk of jumping. So, and there's some good traction there. So like a bedroom, a laundry room, even a hallway that's baby gated, just so that they can't get up and be wandering the house because they're really going to become quite sore after that. But if you are supervising them, and so you're there to kind of monitor what they're doing, they can be in the same room as you, sitting on their bed. That's totally fine, as long as you're just watching that they're not jumping onto furniture. That's the biggest risk here. And when we talk about bedding, we want to make sure that these dogs are getting clean, comfortable bedding, because most likely they're going to be laying down on their bed for quite a while. We also want to make sure that we're flipping them appropriately. So if your dog is choosing to lay on one side versus the other, which is commonly the case, you want to make sure you're getting them up and rotating them kind of every 4 to 5 hours to make sure that they're not going to get any bed sores, okay? So now we're going to talk about some home modifications that you can do. These are ways to alter your pet's home environment to allow them to get around easier and limit hazards during their recovery. So first and foremost, increasing traction. So we really need to do this in high traffic areas. So anywhere that they're going to be confined in should be carpeted and have good traction, as well as putting yoga mats and runners down, kind of put them in the hallways, wherever they're going to be moving around, to really limit that risk of slipping and sliding, because that can also really set them back with their recovery, or even worsen the degree of cruciate ligament tear. So I usually recommend, if they have one pathway that they usually move to go to the back door, to go to the bathroom, put some yoga mats or carpet runners down there just to help make that transition a little bit easier for them. Another way to increase traction is trimming their nails and the hair between their paw pads to allow for good paw pad contact to the ground. That will also help with traction because you can imagine this photo on your left here is kind of like wearing a fuzzy sock on a really slippery hardwood floor. And that's going to make it really, really hard for these dogs to get up and walk around their house. So paw maintenance is really important as well. We want to be able to restrict stair use for these dogs. So stairs really require a lot of force and power from the hind end and can cause a fall or even worsen the condition because there is so much stress on that ligament when they're going upstairs. So we recommend baby gating your stairs or putting up another barricade for them so that they're not able to access that. If your dog is small enough, you're able to carry them up, that's totally fine. If not, and they absolutely need to do stairs, we usually recommend using, a sling or a towel or a sheet of some sort to try to put some support under their belly so that you can alleviate the weight on their hind end as they're going up the stairs. But this is only, if they need to do a couple of stairs going into the house, or they have to go to bed at nighttime, things like that. You can also, on your left here, there's some stair runners that you can get just to put some traction on the stairs as well, to make it a little bit easier for them if they have to do the stairs. Elevating their food and water bowls can help greatly with distributing the weight appropriately along their spine. And so this really, really helps with reducing the stress on that cranial cruciate ligament. Because in this picture here on your left, you can see this dog doesn't have a great angulation of its hind end here, as well as its elbows, and its neck is down, so it's really not good alignment for them. With this photo here, you can see the dog's spine is much more straight. The dog is in a much more natural standing position, and so those knees are not going to be as painful when they're eating. With regards to activity, we want to make sure that all bathroom breaks are on leash and in the yard, and there aren't very many, risks of them running after a squirrel or a bunny or something like that, because they can really that can really set them back in their recovery and or progress the injury even further. We want to start walks once the pet is placing good weight on the leg. So once they're in a good standing position and they're putting the leg down and they're able to weight bear a little bit, that's when you can go ahead and start walks. Okay, so we usually recommend starting with 5 minutes, and these are short, slow, very, very slow paced on-leash walks tailored to your pet's level of tolerance. So if your pet can't tolerate 5 minutes, that's okay as well. Just do what they can tolerate, and you can do that 2 to 3 times a day. Then every week, as their tolerance increases, we want to kind of increase them by 5 minutes every week. Again, if they can't do 5 minutes every week, then you're just going to maybe increase by 2 or 3 minutes. All we're trying to do here is just trying to increase their muscle strengthening and their tolerance, okay? One thing you can do is bring a sling along for the ride with you if you're out and you're worried that they're not going to make it home or they need some support and you have a big dog. It can be quite useful to have a sling there to put under their belly to kind of help them home if you need to. Our general rule is that they should be weight bearing at the end, as good at the end of the walk as they were at the beginning. Okay, so that's kind of how to gauge how far they can go and how much you should be doing with them, because the goal really is to improve their strength, not their pain. Weight management is incredibly important as well when managing cruciate tears. We want to ensure appropriate calorie consumption for these guys because they are on reduced physical activity. So reducing any treats or table scraps is really important. We can use their kibble or low-calorie fruit and vegetables as treats when needed to cut down on calories. Also, if your pet is overweight, more than just a couple of pounds overweight, we usually recommend prescription weight loss diets that are available through your veterinarian because these are really great at getting the weight off in a safe fashion. And so there is a strong correlation between fat cells and inflammation, as we talked about earlier. So overweight dogs really are more likely to develop much more severe arthritis than lean dogs are. So these are some of our favorite prescription weight loss foods that we typically recommend at SOAR. Prescription weight loss foods are scientifically designed to alter the animal's metabolism to promote weight loss at a safe and healthy rate. Okay, so again, don't be afraid to ask your veterinary team. We can definitely give you some recommendations on these types of things. We usually use Royal Canin and Hill's products because they not only have the metabolic and weight loss diets, but they also have combination diets that have joint supplementation built into them. And so we find good results with these diets. They can be ordered through any veterinarian. And of course, when you put your dog onto a weight loss plan, you want to make sure that you're calculating their calorie content or requirements adequately. And so you can always ask your veterinary team, or we can do that for you at SOAR if your pet's coming to see us. Now we're going to talk about some assistive devices. So these are mobility aids that help the pet to perform daily tasks a bit easier. Okay. So first, ramps. So ramps can help larger dogs get manage sets of stairs into the house, or even getting in and out of the car. Small dogs as well, so they can be quite useful, getting the dog to their vet appointments and things like that. Then we have slings. So these can provide support and reduce weight on the hind end to alleviate stress on that affected joint when performing daily tasks. So, helping the dog posture to go to the bathroom, that it's really helpful to have some support under their belly. And so you can make homemade slings. So you can just sew a sling from a towel and some sort of handle. But a nice trick that we usually recommend is using a reusable grocery bag and just cutting it down the sides and opening it up so that it kind of opens up into a little bit of a sling that goes under the dog's belly. And then the handles there from the bag are also your handles to give your dog support. So those work quite well. You can also buy a lot of different types of slings online. And there's also some hind end harness type of slings that are good for some support. The one I wanted to talk to you about is the Help 'em Up harness. And we use a lot of these at SOAR as well. This is a full body harness, so it has a front end and a hind end that are connected. And what that does is it helps to distribute the weight along the spine a little bit easier and lifts the pet from underneath the chest and the pelvis. So it's really ergonomically designed to help make lifting easier for the owner. So it makes the dog actually feel a lot lighter than they are. And it's designed to stay on your pet for extended periods of time. So you don't have to worry about putting it on, taking it off all day long. It's just there if you need it. So if your dog is struggling getting up, or going up and down the stairs, getting up off the floor, getting out of the car, you have that hind end handle there and you can just grab it and help them up. So boots and paw traction can also help with your pet's mobility. It can also help, with traction on the floor, so preventing the slipping and the sliding again. So we have these paw boots here that are just full rubberized. The ones in the middle here are like a sock with a rubberized foot. And then these are called toe grips. So they're a little rubber ring that goes around the nail so when the dog bears weight, the rubber hits the ground, not the nail. So it gives them a little bit of traction when they're getting up. The one thing is you don't want to leave the boots on for an extended period of time because their feet can sweat. So we want to make sure that everything is breathable. As well, you don't want to leave them unattended because some dogs like to eat the boots, and we don't want that. So stifle braces can be extremely useful in promoting proper weight bearing when conservatively managing cruciate tears with rehab. And so these are two different types of braces that we see with rehab. A well-designed custom-made knee brace can offer great support to the stifle joint. Custom fit will ensure proper fit, durability, and provide the best possible stability to the knee. So these braces are usually rigid and they're custom made for the dog. So they do a casting and then they make that brace based on the dog's leg. So it is fit exactly for the dog, and it is hinged so that it allows a little bit of flexion and extension so the dog can take appropriate steps and still sit and still lay down in the brace, but its main job is to just provide stability, and so it prevents that tibial thrust motion, the forward displacement of that tibia, therefore reducing the pain. So these can be quite useful. And so this is a little video here. I'm going to just play this. This is Brody. Brody suffered bilateral cruciate ligament tears last year. He was immediately enrolled in a rehab program in clinic and has been given a home exercise plan. He was started on some pain medication and fitted with a custom brace on his left hind limb, which was his more sore leg at the time. This allowed Brody to do more challenging exercises in the clinic and promote more muscle strengthening for him. Brody is now off all of his pain medication and just on an osteoarthritis maintenance plan of joint supplementation and once monthly rehab sessions. Brody is now able to hike with his dad, which was his favorite thing to do. And so with conservative management, we were really able to give Brody a fantastic quality of life and avoid 2 knee surgeries. So stifle braces can really be a game changer for these larger dogs that, that undergo cruciate tears and are unable to have surgery. So we mentioned that Brody was on a joint supplement plan. So we're just going to talk about some of our favorite joint supplementation that we typically recommend. And so these joint supplements are kind of aimed to preserve the healthy joint cartilage, slowing down progression of arthritis and reducing inflammation within the joint. So omega-3 fatty acids are a really good joint supplement that we typically recommend because they're shown to help with the downregulation of inflammation and cartilage destruction within the joint. And they also improve the clinical signs of osteoarthritis. So there's many different types you can get. We have veterinary prescribed omega-3s. There's over-the-counter capsules. There's veterinary joint diets, that, as we mentioned before, that have the joint support actually in them. And so there's lots of options in terms of that. And so don't hesitate to talk to your vet about getting your pet on some omega-3 fatty acids. The next one I want to talk to you about is avocado, soybean, unsaponifiables. And these have been shown to have beneficial effects in suppressing joint inflammation related to osteoarthritis, as well as repairing joint cartilage. So it can actually help to repair some of the damaged cartilage in that joint. And so these are actually the extracts that are taken out of the avocado and soybean plants. And so dosaquin is the main product that has these ASU products or extracts in it. And we use it all the time at SOAR, and the dogs really do quite well on it. So we typically recommend these. There is a version that has MSM in it that also has been proven to be effective. So now some non-oral joint supplementation. So the big one here is Cartrophin. This is an injectable chondroprotectant that is proven very effective in treating osteoarthritis and promoting long-term joint health. And so this just helps to downregulate enzymes that break down the cartilage. So it really just helps to keep the joint fluid healthy and preserve that joint cartilage. This is usually a once weekly subcutaneous injection for 4 weeks. And then we do it once a month as needed. And a lot of our owners that their dogs are on this product, they tend to start to tell us when their dogs need it. You know, they say that my dog's getting a little bit stiff. I think he's due for a Cartrophin injection. And so we give it to the dog and they end up, you know, really improving a lot after that. You can get these performed at your family vet clinic, or select rehab centers can also provide that for you. So like I said, we do this at SOAR. So pain management plays a key role in how successful we are at rehabilitating cranial cruciate injuries. We must always ensure that the patient is comfortable before we ask them to perform physical exercise, let alone even to allow us to manipulate their limb. Otherwise, this can lead to fear and frustration for the pet and overall unsuccessful rehab session. Pain can make rehab extremely difficult and often slow their recovery. This is why we need to break that pain cycle before we can intervene with any type of physical medicine. Okay, so to manage pain associated with cruciate disease and osteoarthritis, we often need to use a combination of different types of pain medications. We call this a multimodal approach. So each class of medication kind of works differently in the body. For example, NSAIDs help to decrease inflammation. Gabapentin helps to manage nerve-related pain that is frequently associated with osteoarthritis. Amantadine changes the perception of pain in the brain, while Robaxin assists with muscle relaxation. So since cruciate disease is a degenerative condition resulting in both acute and chronic inflammation, secondary osteoarthritis, as well as muscle pain, often one medication does not adequately manage the pain of our patients. So developing an appropriate pain management plan is not a one-size-fits-all method. Each plan needs to be tailored to each individual patient. With that being said, medication that is safe for one pet is not always safe for another, specifically when we are dealing with anti-inflammatories. So your veterinarian may recommend performing blood work before it is to ensure that it is safe to prescribe an anti-inflammatory. And this is especially important when anticipating if your pet may be on these pain medications long-term. So we need to make sure that that it is safe to put them on these medications. So after a cranial cruciate ligament injury, a lot of our patients will need pain medications for at least the first 3 to 4 weeks after the injury to really get on top of their pain levels. We often can wean them off or supplement medications with pain management rehab treatments as well as manual therapy techniques. So they're not always on these pain medications long-term, but some patients with chronic pain and osteoarthritis may need some degree of pharmaceutical management long-term to promote their best quality of life. So in addition to pain medications, there are many other ways you can manage your pet's pain at home, and we're going to go through a few of those. So the first is cold therapy. So ice packing causes those blood vessels to constrict, therefore decreasing blood flow to an area. Okay, so we're going to reduce the swelling and the inflammation as well as the pain in the area, which is most likely the knee. We use this in the acute inflammatory stage, so usually up to 72 hours after the injury. So that's the first 3 days after the injury. However, we want to continue cold therapy until all of the active swelling has resolved, okay? And then usually after that, we can switch to heat, but we're going to discuss more of that in phase 2 webinar. When you're icing, you want to make sure that you're protecting the patients from frostbite. So we want to make sure that you're wrapping that compression or that ice pack in a towel, or I even use a pillowcase sometimes because it's a little bit thinner than a towel. And we usually recommend applying the ice to the knee joint 10 to 15 minutes, 2 to 3 times a day to the affected joint, okay? And now let's talk about heat therapy. So heat therapy does quite the opposite of cold therapy. It causes the blood flow to increase to an area, which promotes healing and extensibility of the tissues, as well as reducing pain and inflammation. So a lot of the times the spine or the groin areas can often become sore because the animal is compensating and overusing those areas to accommodate for their cruciate injury in the knee. And so heat can help provide some pain relief and some muscle tension relief to these areas. So with heat therapy, we usually recommend using a microwavable oat bag or a hot water bottle, or if you don't have any of those, even just some rice or dried beans tied up in a sock and throw that in the microwave. We do not recommend electrical heating pads because they can get quite hot and they're not really that safe for the patients. So you want to apply the heat pack to any of the areas of discomfort that your dog is experiencing, whether it's in the back or the groin area, and you're going to do that for 10 minutes, 2 to 3 times per day. Okay, so next we have TENS therapy. So TENS is called transcutaneous electrical nerve stimulation. And so this involves the use of low voltage electrical currents to help to treat pain. So the TENS machine will deliver an electrical current to or near the targeted nerves. And what this does is it blocks those pain pathways and changes the way that the patient will perceive pain. Okay, so it really does well reducing the pain in whatever area you're applying it over. So owners can purchase a TENS machine at home to use. So we've been using this a lot lately for patients that can't come into the clinic. And you want to make sure that you apply the pads over the knee joint to help reduce the pain and inflammation. We recommend 10-minute treatments, and these are our settings here. So we recommend 25 hertz, 300 microseconds, and your milliamps, which are your intensity. And you want to dial that up just to a comfortable range so that your pet is tolerating it well. Okay, so it should never be a painful experience for them. The other thing we can use is pulsed electromagnetic field therapy, which is the main one here is something called the Assisi loop. And what this does is it uses electromagnetic waves to accelerate tissue healing and reduce pain and inflammation in the damaged tissue. So it's great because it has pre-programmed protocols and it's easy application for the pet. So you can see this dog just has it right over the knee. It's very easy to just loop it over. You press the button on it and it'll run for 15 minutes. These treatments can be done 2 to 3 times a day, so it can be done quite frequently, but they do need to be purchased through your veterinarian. So we typically keep them in stock at SOAR, or you can get them purchased through your family veterinarian. So LED infrared light therapy can also be very beneficial in reducing pain and inflammation. It works very similar to laser therapy, but it just does not penetrate as deep. So what it does is it increases circulation and sometimes actually heats up the tissue to help with healing in that targeted area. And so because it doesn't penetrate as deep, we usually recommend it for superficial wound healing. So for incisions after surgery, it's a great way to reduce the redness, or even if the dog has an infection, it's great for treating that, as well as alleviating muscle tension in any type of areas. So it works very similarly to heat in that respect. This particular one is called the LunaSoothe and can be purchased online, as well as like on their website or Amazon. If you're not able to appropriately manage your dog's pain at home, there are many treatment options that we can provide in clinic to improve their discomfort after a cruciate ligament injury or even surgery. And these treatments target acute and chronic pain and inflammation in the knee, compensatory muscle discomfort, as well as osteoarthritis pain. So we're treating kind of everything. And so we often use laser therapy, we have acupuncture, ultrasound, and TENS. So these are all kind of geared towards pain management and promoting healing. So now that we have achieved appropriate pain control, we can actually start to introduce some physical exercises for these dogs. So passive range of motion is the easiest and most tolerated physical exercise. And so it involves the use of an external force, which is our hands, to move a joint through its full motion without any voluntary muscle contraction. And so passive range of motion really helps to prevent any joint contractures, so stiffening of the joint, preventing shortening of the muscles or tendons in that area, reducing or slowing the rate of muscle loss of that limb, enhancing blood flow, lymphatic flow, increasing joint fluid production in circulation, and reducing pain. So it really is an all-encompassing approach to maintaining the health of that limb. So this video here, you can see how passive range of motion is done. And so we usually recommend about 10 to 15 repetitions, 3 to 4 times a day, and 1 flexion and extension is 1 repetition. Passive range of motion is often continued throughout the entire recovery process because it is so great at maintaining joint health and optimal movement of the limb. So when you're doing range of motion, you really want to make sure that that ankle is getting right up to the back of the leg there, and then extending it as much as you can, but again, to the patient's level of tolerance. So again, it should never be a painful procedure for them. When the knee joint swells, the fluid will often settle into the lower aspect of the limb, and this is just due to gravity, that the fluid will kind of come down. It's usually in the ankle area, and it is more common after surgery. And massage can really help to guide that fluid back into the body to help it with reabsorption. And so really what you want to be doing is just doing a gentle kind of guiding, milking motion, moving from the end of the leg towards the body. So we always want to move the fluid back into the body so it can be reabsorbed. Now, after a cruciate injury, we have talked about how the dogs will typically shift their weight and alter their posture, and these dogs can get compensatory muscle discomfort in these areas. And so specifically in the groin, as well as in their usually lower back or shoulder area. And massage therapy can definitely help to relieve some of this muscle tension. And so the technique you want to use with this is just kind of grabbing that muscle with your thumb and forefinger and doing circular type motions and grabbing it gently, but with a little bit of firm pressure and kind of just moving down that muscle, and you'll actually feel it kind of loosen up. So encouraging weight bearing on the limb is an essential part of cruciate recovery. Dogs can often learn to accommodate quite well with their injury by shifting their weight to their other 3 legs. So over time, this can become habitual and can cause progressive muscle loss on the affected limb, as well as injuries to the other 3 limbs and the spine because of overloading. It is important to get them safely weight bearing on the injured leg as soon as possible, because once they've learned to manage on 3 legs, it can be quite difficult to convince them otherwise, especially in smaller breed dogs. So we really want to make sure that we're doing gentle static standing weight bearing exercises as soon as they're able to weight bear appropriately. So kind of the same time we're going to start doing those walks is when they can stand and they can put weight on that leg safely and comfortably. And so they may need a little bit of assistance with these exercises. So you can use a sling or a harness if you have one at home, or make one like we had mentioned. So what you want to do is just provide some manual weight shifting with your hands to encourage weight bearing on the affected limb. And what this is going to do, it's going to promote muscle engagement. So we're going to prevent any muscle atrophy in that limb. We're going to increase the joint fluid production because we're going to get weight bearing and compression of the joint, which is going to get the fluid to move around. As well, we're going to promote neuromuscular re-education of the muscles, as well as proprioception. So we're going to kind of teach that standing position. So we kind of just need to remind them of how they need to stand. Okay, so in this video, this is called 4-leg standing, and you can see the weight shifting happening. It's not wanting to work. So essentially what you can do is you can just stand your dog on a carpet or a yoga mat, or even while they're eating dinner, you can do this. You can do it on a bed, their dog bed, so it's a little bit squishy if they need a little bit more of a challenge to weight bear on that leg. And so this is kind of what it looks like here. We're just going to gently shift from side to side just to try to get them to engage. We usually recommend 1 to 2 minute intervals frequently throughout the day. So you really can't do this exercise too much because it is very gentle and very slow, as long as they're doing it in a controlled fashion. And then if they're strong enough to do so, you can actually lift one of their front legs. And what this does is it alleviates the weight on that front leg, shifting it to the hind end, making that one leg work a little bit harder, okay? So we lift up here, and then with your hand under their belly, or even with some gentle pressure on the other side, we can just shift them side to side. We recommend lifting each paw for about 5 seconds, and then alternating, and then do about 5 repetitions at each paw, 2 to 3 times a day. Again, we want to make sure it's to your pet's level of tolerance. So if they are struggling at all, then don't do the 3-legged standing and just keep all 4 legs on the ground. Now, of course, if you're having difficulty getting your dog to weight bear after their cruciate injury, there may be an aspect of pain to it. So we need to make sure that we're, keeping close eye on and altering their pain management plan if needed so that they're more willing to weight bear on that leg. Or we can also get them in for a more structured in-clinic rehab program, because some dogs, they just need a different surface for them to feel that they need to weight bear on that leg, because again, they can develop some habits. So sometimes we just need to challenge them. So we can use some stability equipment in the clinic to encourage weight bearing and start gentle engagement of muscles and limb proprioception. So again, spatial awareness of the legs, which is the proprioceptive surface on these discs, can help with that. We always have them assisted here, so we're never making them do it on their own. So we can provide some hind end assistance if need be, but it's very, very gentle, controlled exercise. So our main take-home points for this webinar is we just want you to know that CCL injuries result from instability in the knee, which causes pain, decreased limb use, and progression of osteoarthritis. We must know that there are both surgical and conservative management options for treatment of cranial cruciate ligament tears, and all options and risks must be considered before we decide on any appropriate treatment plan. We want you to know that early intervention is crucial in slowing down the progression of arthritis. And there are many techniques we can apply at home to improve our pet's pain and mobility within the first 2 weeks after their injury. I hope this webinar has given you some insight as to what cranial cruciate ligament ruptures are, how it can affect your pet, and how we can help them with the recovery in the first 2 weeks. Stay tuned for our phase 2 webinar, which will cover management of the cranial cruciate ligament tear from week 2 to 6 post-injury. At SOAR, we are currently offering virtual appointments for patients who have recently suffered cranial cruciate ligament injuries or have undergone surgery to repair their cranial cruciate ligament. We can virtually assess the pet and build a custom rehab and home management plan to suit the pet's needs. This is a 30-minute appointment for a fee of $87.50 plus tax. And if you're interested in a one-on-one consult, or if you have any questions about your pet or patient, feel free to reach out via email at soarvetservices@gmail.com or call us at 905-961-7627 for more information. Does anybody have any questions? I'll just leave the chat open for a few minutes. In case you have any questions, feel free to fire them off, or you can always email us afterwards. Everybody who listened to this webinar will be receiving a recorded version, so you can watch it back. And if you have any questions after that, you can definitely give us a call or email us as well. But I will leave it open just for a few minutes in case anybody has any questions. Okay, so we have a question here. I'm just going to read it aloud so everybody can hear. It says, we have a 75-pound husky. He has torn both cruciate ligaments in the last 2 months. He's now putting weight on both, but should we be restricting the amount of getting up from sitting or laying down on his own? Okay. So I would say, is he struggling? If he's struggling to get up, I would be restricting that. It depends on how much weight bearing there is. So, you know, if he's still unable to walk a far distance, so it depends, you know, if he's able to go for like 5-minute, 10-minute walks, then it should be okay for him to be getting up, as long as there's good traction there and the risks of, you know, him getting up aren't going to make his condition worse or make him more painful. So it also may be a factor of getting him some pain medication so that you could get a little bit more weight bearing on those legs, so that, you know, if he's a little bit more sturdy when he's getting up. Does that answer your question? Also, do you have a harness or a sling for him? Because that could make it more, that could make it easier, and then at least you know that you have that backup, that if he does try to get up and he slips, you can at least grab him. That's where those help him up harnesses are really beneficial. Okay, so he's stubborn and full of energy. We've been minimizing most mobility, but if he can do it on his own, is it beneficial? I would say yes, it would be beneficial as long as there's good traction there. So there's a difference between a dog trying to get up on a slippery surface that can actually be a hazard, versus actually trying to get up on a yoga mat or a carpet, because they're using their muscles to get up. And so at some point they do have to learn to do that on their own. And that's okay, as long as it's a safe environment for him. That is the biggest thing I can stress, is that especially with both their cruciates torn, it's really important that there's no slipping and sliding hazards there, because if he slips from one side to another, you can increase the amount of cruciate tear that's there. So you want to kind of preserve as much as you can by just limiting the slipping. And if, you know, he's going to get up on his own and try to jump on the couch, that's also a hazard. So in that case, I wouldn't promote that. But if he's just going to, you know, kind of move from one dog bed to another, I think that's totally okay, as long as there's carpet or yoga mat down for him. Do we have any other questions? He does have a meniscus tear as well. He just had x-rays done yesterday. Does that change taking him for walks? Nope. So it may make him more painful because okay, so it's just one knee. You said that's, okay, that's popping and cracking. Okay, so with the meniscal injuries, those can be quite painful. So my next question would be, what is his pain management like? And so if that's, if he's on pain management, then great. At least we've got something on board so that, you know, we can make his walks a little bit more comfortable. So that's, pain management really is the deciding factor in kind of how we can progress these dogs, is what we're doing making them more sore, because that's never our goal. And so if he is on pain medication, oh, he's on, okay, so he's on Metacam and gabapentin, so that's fantastic. So he's on a decent pain management plan. So if he's able to get up and go for walks, I think that is definitely okay. Something for him, I don't know what your plans are in terms of treatment going forward, but I would recommend a structured brace for him, because what can happen is the more walking and the more movement of that knee can actually increase the severity of the meniscal injury, and we don't want to do that. So we want to provide stability to his knee. So what I would recommend would be either, you know, we could set up a virtual consultation to see what he actually looks like when he's walking, and we can further kind of guide you on how to do that safely, and we can give you some exercises to do at home, because he may not be ready for a walk depending on, you know, what he can tolerate. You know, you can always try it and see if he can, you know, go for that 5-minute walk, and, you know, progress him just like we said in the webinar, very, very slowly. But we can give you some exercises to do with him at home that, you know, may allow him to kind of build up enough strength that he can go for a walk. And so often that's the case, is we need to start with a home plan and then try to start walking them once we get them comfortable, and, you know, we're doing the passive range of motion, we're moving the joint a little bit, because a lot of the times it's stiffness and, you know, joint stiffness, muscle stiffness, things like that. So what I would do is try some of the techniques that we talked about in the webinar. You know, try your 5-minute walks if you can, and see how he responds to that. And if he gets worse, then you may need to alter his pain management plan. If he does well, then, you know, consider a virtual consultation with either, you know, us at SOAR or another rehab facility to kind of further guide you and tailor a plan specifically for him. It is quite challenging to recommend, you know, a treatment plan for a dog with 2 cruciate tears, because not all of them are the same, and they don't all look the same. They're one of the most complex injuries we deal with at SOAR. And so each dog kind of has to be treated differently, especially when there's 2 legs involved. So if that's all the questions, I'm going to end the webinar. Definitely either email us or give us a call if anybody has any questions or is looking for, advice or getting a virtual consult set up with us at SOAR. You'll probably be hanging out with me, so I'm looking forward to meeting any of you. And thanks so much for joining me tonight. I hope you learned what you came for, and stay safe and healthy, everybody. Bye-bye.